So before we start to look at the sequence of cutting, let's talk about what sorts of scissors you should be using. So this was a question that has come up in workshops as well. And when I've spoken to the occupational therapists that I work with, the answer is that we should provide a variety of scissors because of course you're going to have children with all different abilities in your group, some who will be quite confident and have had a lot of experience using scissors and some who have not been exposed to them at all. So this is the first style of scissor, and I would call these like a plier scissor. So all that you're doing with these ones is actually squeezing them shut using the whole hand. So the thumb is on one side and all the fingers are on the other side to push down. They open automatically by themselves. So it's just a push down and a release. So plier scissors would be the basic. Then children might graduate to these sorts of spring-loaded scissors. So here they're more traditional looking. We've got two different sized openings, so the smaller one for the thumb and the larger one for the other fingers, and this little spring load here. So the thumb goes in the small opening, and once again it's just closing, open, close and open. The scissors are springing open automatically, but we're needing to do that cutting action by ourselves. Of course, children who are left-handed need to have left-handed scissors. So it's important to perhaps have different colour coding on the scissors that are left-handed. But of course, young children may not have developed hand dominance at this stage. So one way that you can help children to start to feel dominance in one side of their body is to consistently present them with the tool at their midline. So then whichever hand they extend forward to grab the tool is the one that they're going to be using. And then hopefully you will see a dominance start to occur. Another way to help children is to get them to imagine doing a routine task. Like you could say, imagine, show me how you're brushing your teeth. And so the hand would come up and they would start to brush their teeth. Or, can you show me how you would brush your hair? And the hand would come up to brush the hair. That's the hand you're going to use for your scissors. So it's just repetitive. Quite often it's an involuntary action on our preferred side, and it really will help children to develop dominance on one side of their body, which is important for perfecting the fine motor skills, both of handwriting and of cutting. Then we would graduate to regular scissors. These are a little bit of a point on the tip. Is that coming up? Okay, yeah. One good idea is to put a little bit of tape on the hole where the thumb goes. So these ones are a little bit, make it a bit easier because we have a smaller opening for the thumb and the larger opening for the fingers. But if the openings are standard size, put a little bit of tape where the thumb goes. Of course, another tip that I frequently talk about is drawing happy faces or using little stickers on the children's thumbnails. So we always remember that thumbs are pointing up. Cutting elbow stays fairly close to the side of the body, and the tips of the scissors always face away from us. So this is twofold. It stops children crossing or turning their hand over and coming back to cut towards themselves, which of course means that there's a danger of us cutting our clothes, but it's also a safety measure that the tips of the scissors are always cutting away. So they're the different sorts of scissors that we would recommend that you have available to the children. Try and buy good quality scissors because there'd be nothing more frustrating than having the right technique but having the wrong quality tool so that you're not seeing results for your effort.